I've started working more with functional nutrition. So this is a part of that overall concept. So can everyone see this all right? Kind of get to know each other as tight quarters, right? So tonight we're going to be talking about the hidden cause of illness and how to stop it. And spoiler alert, we're going to be discussing chronic inflammation a lot. You're going to hear me repeating that word over and over again, but we'll get down to a little more explanation about it as well. So first we'll go over some house rules. If you could make sure your phones are turned off, that'd be great. So if I lose my train of thought, I might have to start over. You guys don't want to hear it all again. And if, at any time you're uncomfortable sitting too long, feel free to stand up. I know it's a little tough when it's tight in here, but if you need to stand at the back of the room or go get more food or snacks, be comfortable doing that, all right? That doesn't bother me one bit. Don't hold it. The bathrooms are up front by the water cooler. And also, I'm going to try to pause at certain times to ask a question, but if you feel like you need to raise your hand and ask me something, feel free. And we'll also leave a little time at the end of the talk to answer questions. If anything's too complicated and we can't really get it done quickly, I might just set up a time to talk to you later, or maybe we can do it afterwards on an individual basis. Or honestly, I don't know everything about the topic, so if it's something I need to look up and learn more about and get back to you, I'll let you know that as well. So let's get started. First off, what is inflammation? Inflammation, the word, means to set alight or ignite. It's kind of like turning the thermostat up in your body. It's a beneficial and necessary part of protection and healing, and it's very important in healing of wounds and within the immune response. And this is the type of immunity that you're born with. You don't have to be exposed to an antigen to have inflammation occur. It's an automatic response. There are two types of inflammation: acute inflammation and chronic inflammation. Acute inflammation is essential to survival, and there are 5 different components of it: pain, redness, immobility, swelling, and heat. These examples can be noticed with an infected cut or with something like tonsillitis. When these tissues are inflamed with acute inflammation, they're tender, they're red, they're swollen. You don't want to touch a cut. You don't want to swallow if your tonsils are swollen. But this can also happen with soreness after an intense exercise. If you're out lifting weights, you get that pump in your muscle because the fluid flows into that area to help heal the muscle fibers that were damaged during the exercise, so they then can become stronger muscle tissue for you later. So it's a very beneficial system, and it's good that we have this in place. Acute inflammation begins rapidly and is present for a few days or a few weeks. Next, I'm going to show you a video, and with this video, it gets complicated because we're talking about all the different cells and components of the inflammatory and immune response. So I'm not going to quiz you later because there's a lot of information in it. But what I want you to gather is, what a broad system this is. And it talks a lot about how the inflammatory process ends. And I want you to think what would be happening in your body if it didn't end, if it perpetuated and continued. And then there'll be some of the cells that we'll talk about later as we get into it. So let's go ahead and play that.
Every second of your life you are under attack. Billions of bacteria, viruses and fungi are trying to make you their home. So our bodies have developed a super complex little army with guards, soldiers, intelligence, weapons factories and communicators to protect you from, dying. For this video, let's assume the immune system has 12 different jobs. For example, kill enemies, communicate, etc. And it has 21 different cells and 2 protein forces. These cells have up to 4 different jobs. Let's assign them. Here are the interactions. Now, let's make this understandable. First of all, let's add colors to the jobs. Now, let's illustrate the cells. The central color represents the main job of the cell, while the surrounding ones represent secondary duties. Now, the immune system looks like this. Now, the interactions. Isn't this complexity just awesome? For this video, we will only talk about these cells and ignore the rest. So, what happens in the case of an infection? It's a beautiful day when suddenly a wild rusty nail appears and you cut yourself. The first barrier of the immune system is breached, your skin. Nearby bacteria seize on the opportunity and enter your wound. They start using up the body's resources and double their numbers about every 20 minutes. At first, they fly under the radar, but when a certain bacteria population is reached, they change their behavior and start to damage the body by changing the environment around them. The immune system has to stop them as fast as possible. First of all, your guard cells, known as macrophages, intervene. They are huge cells that guard every border region of the body. Most of the time, they alone can suffocate an attack because they can devour up to 100 intruders each. They swallow the intruder whole and trap it inside a membrane. Then the enemy gets broken down by enzymes and is killed. On top of that, they cause inflammation by ordering the blood vessels to release water into the battlefield, so fighting becomes easier. You notice this as a very mild swelling. When the macrophages fight for too long, they call in heavy backup by releasing messenger proteins that communicate location and urgency. Neutrophils leave their patrol routes in the blood and move to the battlefield. The neutrophils fight so furiously that they kill healthy cells in the process. On top of that, they generate barriers that trap and kill the bacteria. They are indeed so deadly that they evolved to commit suicide after 5 days to prevent them from causing too much damage. If this is not enough to stop the invasion, the brain of the immune system kicks in. The dendritic cell gets active. It reacts to the signals of the soldiers and starts collecting samples from the enemies. They rip them into pieces and present the parts on their outer layer. Now, the dendritic cell makes a crucial decision. Should they call for antivirus forces that eradicate infected body cells, or an army of bacteria killers? In this case, antibacteria forces are necessary. It then travels to the closest lymph node in about a day. Here, billions of helper and killer T cells are waiting to be activated. When T cells are born, they go through a difficult and complicated training process, and only a quarter survives. The surviving cells are equipped with a specific setup, and the dendritic cell is on its way looking for a helper T cell with a setup that's just right. It's looking for a helper T cell that can bind to the parts of the intruders which the dendritic cell has presented on its membrane. When it finally finds one, a chain reaction takes place. The helper T cell is activated. It quickly duplicates thousands of times. Some become memory T cells that stay in the lymph node and will make you practically immune against this enemy. Some travel to the field of battle to help out. And the third group goes on to travel to the center of the lymph node to activate a very powerful weapons factory. Like the T cells, they are born with a specific setup. And when a B cell and a T cell with the same setup meet, hell breaks loose. The B cell duplicates rapidly and starts producing millions of little weapons. They work so hard that they would literally die from exhaustion very fast. Here, helper T cells play another important role. They stimulate the hard-working factories and tell them, "Don't die yet, we still need you, keep going." This also ensures that the factories die if the infection is over, so the body doesn't waste energy or hurt itself. But what is produced by the B cells? You've heard of them, of course, antibodies. Little proteins that are engineered to bind to the surface of the specific intruder. There are even different kinds of antibodies that have slightly different jobs. The helper T cells tell the plasma cells which type is needed the most in this particular invasion. Millions of them flood the blood and saturate the body. Meanwhile, at the site of infection, the situation is getting dire. The intruders have multiplied in number and start hurting the body. Guard and attack cells fight hard, but also die in the process. Helper T cells support them by ordering them to be more aggressive and to stay alive longer. But without help, they can't overwhelm the bacteria. But now the second line of defense arrives. Billions of antibodies flood the battlefield and disable lots of the intruders, rendering them helpless or killing them in the process. They also stun the bacteria and make them an easy target. Their back is built to connect to killer cells, so they can connect and kill the enemy more easily. Macrophages are especially good at gnoming up the bacteria which antibodies have attached to. Now, the balance shifts. In a team effort, the infection is wiped out. At this point, millions of body cells have already died. No big deal, the losses are quickly replenished. Most immune cells are now useless, and without the constant signals, they commit suicide, so as not to waste any resources. But some stay behind, the memory cells. If this enemy is encountered ever again in the future, they will be ready for it and probably kill it before you even notice. This was a very simplified explanation of parts of the immune system at work. Can you imagine how complex this system is? Even at this level, when we ignore so many players and all the chemistry. Life is awfully complicated, but if we take the time to understand it, we always encounter endless wonders and great beauty.
All right, so you can see it is quite a complicated system. And that is only talking about the bacterial invasion. Now your body will put out the same response with the virus, but also it can do that to different foods or chemicals in your cosmetics or in your cologne, things that you may apply on your body every day. So at this point, does anyone have any questions? No quiz? You don't want a quiz? All right, so they talked a lot about how these cells will commit suicide after they've been going for a long time, so they don't do too much damage to the body. That's called apoptosis, when a cell will die on its own accord. And when that doesn't happen, or when you're having that continued influx of irritations or a substance that's causing the inflammation, then that inflammatory and immune response continues, and it can become detrimental. And when that occurs, we have what's called chronic inflammation. Chronic inflammation lasts for several months to several years, or even more. It is detrimental to our bodies. And so within the scientific research, we're not sure exactly what the causes of chronic inflammation are, but we do know some key factors. Something that can continue it is a failure to eliminate the cause of acute inflammation. An easy example of this is if you have a tendinitis, you hurt your rotator cuff in your shoulder, but you continue to do the activities that hurt it in the first place, you're going to continue to have inflammation in that area without rest or eliminating the cause of that inflammation. The next is to have chronic irritants at a low intensity. If your body comes in contact with the Ebola virus, you know that it's going to mount a major attack against that virus because it is quite a danger. But if you have less serious irritants that are coming at you all the time, you're always mounting a defense against those irritants, maybe on a lower level, but it's happening all the time. So you're having a chronic irritant of a low intensity, and it can put your body into a constant defensive mode. And when your body, or even just singular cells, are in that defense mode, they can't be in a mode of growth and repair at the same time. So if you're always busy fighting a battle, you can never get better and heal. And chronic inflammation can lead to autoimmune response to an antigen. So you saw how we created antibodies with these antigens, and something that can happen in the body is when remember the brain cells, the dendritic cells, they took apart the invader and they presented parts of it on the outside of the cell so it could be flagged as a bad guy. Your body can, for some people, take parts of your own body and present it as a bad guy on the outside of the cells. For example, in rheumatoid arthritis, it takes the cells of the small joints in the hands and feet, and the body starts to attack those joints. For someone with multiple sclerosis, it attacks the outer coating of the nerves. So this is the way autoimmune disorders work. We don't always know why they start, but there is a chronic inflammatory process with it. So, effects of chronic inflammation. Nearly all chronic disease has a link to chronic inflammation. Sometimes it's the inflammation that starts first, sometimes it's disease that starts first, but they become one with one another. Some examples are inflammatory and osteoarthritis, skin disorders such as eczema, psoriasis, and then moving into psoriatic arthritis, ulcerative colitis or other inflammatory bowel disease like Crohn's disease, or even irritable bowel syndrome. Type 2 diabetes just gets the entire body inflamed. You're working with the vessels and all the way to the nerves. It's really a damaging disease. Vascular disease, we know now with research that cholesterol will not stick to the inside lining of your vessels unless they are inflamed. So your cholesterol can be high, but if your vessels are like Teflon, it's going to slide right through. But if you're inflamed, that's when you get the hardening of the arteries that leads to heart disease and stroke. Alzheimer's is more and more research is showing they're calling it a type 3 diabetes. It's a state of really prolonged inflammation, and it starts to attack the brain cells and adds in a factor of aluminum to the protein bundles. And finally, cancer is linked with chronic inflammatory disease or chronic inflammation, such as pancreatic, lymphoma, prostate, ovarian, colorectal, and lung. And once again, we don't always know which came first, but they are linked when it comes down to it. So, some common risk factors of chronic inflammation. They're not the same for everyone, but these 8 are found to be pretty consistent. First is poor sleep quality. You need to get enough sleep and you need to get good sleep. And that's not always the same for every person, but you know, general rule, we're talking about 7.5 hours, I think is what they found is a pretty good number. Obesity, when you are overweight, fat cells create a state of inflammation in your body. And when you're inflamed, then you create an environment that makes it easier to gain weight. So you kind of get stuck in that negative feedback loop, but they do feed off of each other. Age, as we age, our bodies just become a little less efficient, so it's harder to shut off that inflammatory process. Also, we've come in contact with more substances and made more antibodies through our lives, so it's quicker to react, and inflammation just sets off a little easier. Stress, or more importantly, how we deal with stress. Some people can have stress and it doesn't change the chemical or the processes in their body. But if for other people it brings them down, it changes the way the body works and reacts to it and leads to an inflammatory state. Low sex hormones, testosterone and estrogen help with an anti-inflammatory type properties. Smoking, it's bad for you, don't do it. It creates massive inflammation everywhere. So don't be around it and don't do it yourself. Periodontal disease, the reason that creates a chronic inflammation is when your gums are inflamed, it's really easy access for a lot of different foreign substances to get into your bloodstream, and your body starts to react and deal with that. And finally, your diet. A poor diet can lead to a lot of increased inflammation. So I'll pause here. Does anyone have any questions at all?
I just have two things to add to that. My family is prone to psoriasis, and I had it for 20 years.
Right.
And I was watching what I was eating, and every time I ate American cheese, my elbows would itch.
Okay.
I stopped eating American cheese, and I haven't had psoriasis in 15 years. Just from that simple change.
Yeah.
And when I eat bread the next day, I feel like I've been run over by a truck.
Yep. So you've already noticed some food sensitivities.
Yeah, so I was paying attention to what goes in and how it reacts.
Okay, and we'll get into some of those immediate responses versus some things that may not be as easy to tell. All right. So now I'm going to tell you a little bit why this excites me so much and why I'm interested in this topic and my own personal journey. It was probably about 2 years ago. I was having a lot of stress in my life. I dealt with that stress by eating pretty poorly half the time and okay the other half the time. I also was doing a lot of excessive exercise because it helped my mind deal with my stress. So after I exercised, I would feel very sore. And that soreness would last a few days, and then I'd exercise again and feel very sore. So that was kind of a constant process, but I could explain it because I was kind of pushing myself. And then I got a shoulder injury, kept lifting weights and doing too much, and the shoulder injury continued, got worse, continued. Pretty soon I had to stop doing the exercise because of my shoulder. It was also making my work as a chiropractor quite difficult. So when I stopped exercising, I noticed my body was still just as sore as it had been during the excessive exercise. So I couldn't explain it away anymore. My shoulder injury wasn't healing even with as much rest as I could give it, and that was continuing. Then I started to get worse pains. I was having trouble with my feet and my knees and my back and my neck. When I got out of bed, I would have trouble walking to the bathroom and getting to be able to stand up straight. And then it started in my hands, and the hands were the thing that really got me because my job, I use my hands all day as a chiropractor. So I went to see my primary care physician, and she ordered a myriad of tests. I was pretty sure that rheumatoid arthritis was going to be a positive test, and I had to deal with that diagnosis. Luckily, that was not the case, but I did have high inflammatory markers. So she said, you have some sort of an inflammatory arthritis. We don't really have a name for it. And then she gave me some options, and the options were medicines or see a rheumatologist, and some things that you may have heard. Wait it out, take Advil, things like that. So in my practice as a chiropractor, I have people sit down so often and say, I felt great until I turned 40. I felt wonderful until I turned 50. Everything went downhill when I turned 60. It's a different age for so many people. And there was one day when a lady came in and she was 83. She said, oh honey, I felt so good until I turned 83. I want to be her. She's awesome. And I'm thinking to myself, I'm sitting here saying, man, I felt great until I turned 35. That was not an acceptable answer for me at all. So I sought out I have access to a lot of holistic practitioners, found a nutritionist who introduced me to the program I'm going to introduce to you. And I'm happy to say that I don't have those aches and pains anymore. I notice when things I eat that are bad, for me particularly, start to creep up, and I can make changes quickly. So it's been a very positive experience, and luckily I'm on that right road path, not the one on the left. So traditional treatments of inflammation, like I talked about, you get offered NSAIDs, painkillers, different ways to deal with the pain. Most of them are pharmaceutical, unfortunately. There are some supplemental anti-inflammatories. Turmeric is a great one, OPC, fish oil.